So now we're going to move on to the part of the program where our teams get to come up and pitch. I'm Alex Morrison. I'm the Managing Director for the Sling Health National Executive Board. And you guys have had a chance to see some of the amazing teams and their posters earlier. We have 9 chapters across the country now, and you've seen teams from the majority of them, and now we're going to get to see 8 of the teams that were selected as finalists to give presentations that represent 4 of our chapters from around the country. So a really incredible group of teams, a incredible group of people, and then we also are going to have an incredible group of judges, and Kayvon's going to come up and introduce them real quick.
Hello, everyone. My name is Kayvon Javaharian. I'm the president of Sling Health here in St. Louis, and I wanted to introduce the esteemed panel of judges that we're lucky to have tonight that will be judging every single presentation. First up, I wanted to introduce Victoria Freddy, if you would stand up and say hi to everyone. She is the program manager for the Healthcare Innovation Lab at BJC and WashU. Then there's Soren Vaduva. He is an entrepreneur that's been a mentor for us since before we even begun. And so he's been around every single year, which has been fantastic. We got Kaushik Srinivasan. He is a healthcare consultant that works with early stage companies and has also been a great mentor for us over the past couple of years. Tom Javor, the assistant director of the University of Missouri in St. Louis Innovation and Entrepreneurship Center. And then finally, Marjorie Melton, the president at M3 Engineering Group, which provides consulting services to organizations. So without further ado, I will hand it back to Alex so that we can go ahead and get started.
All right, so please join me in welcoming our first team, Communicare. They're from St. Louis, and they are working on enhancing chronic disease management by leveraging social networks.
I guess I'll just use the stand. We're socializing medicine, but not the way this guy wants to. I'm Sean Vade, the CEO of Communicare Plus. We're a platform that enhances chronic disease management by leveraging social networks, and we're asking for $5,000 to fund user experience trials this summer to continue enhancing our already existent product. Before I get to the rest of the presentation, I have to thank and acknowledge the rest of the folks who have helped me bring us this product here today. First, my core operations team is comprised of folks with clinical backgrounds, engineering backgrounds, data science, and also public health backgrounds. My business advisory team is comprised of 3 of my fellow MBA classmates from WashU. One of those folks is actually a board fellow with the American Diabetes Association, and that's been very helpful. And then my industry advisory team is about as robust as one as you'll find here in the city of St. Louis. We have the VP of Home Care from BJC, a business development writer from Centene, a PhD in user experience, a private equity investor, and a professor of nursing at the Goldfarb School of Nursing on this team. These 3 groups, when brought together, have the diversity of experience and expertise to build a sustainable, long-term engaging product. Furthermore, we have the motivation to bring it to market fast. So we wanted to identify a real problem to solve in the healthcare industry. And we decided, let's think as big as we can. And what we found is that 75 cents of every dollar in healthcare is spent on chronic diseases. On top of all that, what we determined was that perhaps if we were to leverage the social networks of a patient, their outcomes would in fact improve. And so we wanted to test that hypothesis by building a product that addressed the underlying issue of a lack of social circle engagement. And what we designed was a product that addresses that head on. We landed on type 2 diabetes as our initial testing ground. Just for background, there are nearly 750,000 new diabetic cases diagnosed every year for folks between 45 and 64. This basically accounts for almost $240 billion in direct medical costs. So the average diabetic patient will spend nearly 2.5 times as much in direct medical costs in a given year versus their non-diabetic counterparts. We aren't the first people in the industry to try to figure this thing out, right? But our distinct competitive advantage comes from the fact that we can effectively measure and manage social circle engagement and relay that information to the health system to intervene with patients who need additional support and resources. Further, we're trying to compete on 2 distinct variables. First, on price, and second, on complexity, because we believe that the combination of those 2 in the right arena can lead to longer-term, more sustainable engagement. Where our competitors fail today is that after 6 months, patients drop off and stop using them. And we think these two variables are high contributing factors to that phenomenon. Where we want to play is in the low complexity, low price arena to drive longer term, more sustainable engagement with both patients and their non-clinical caregivers. The research suggests that our lens is actually effective. Just here in St. Louis, a study indicated that patient self-efficacy, disease knowledge, and self-care all increase when family members are more engaged. Stacy from BJC indicates that harnessing the potential of the lay caregiver and leveraging technology are key to improving healthcare in our country. At CommuniCare Plus, this is what we're doing. So we've built a platform, a mobile application to begin, that essentially connects the lay caregiver to patients through a proactive, engaging mobile application built on a foundation of simplicity, behavior-based research, and clinical insight. And we built the product with 3 distinct pain points in mind. The first is that users are overwhelmingly upset with the fact that all their icons and text are far too small on their apps. All of our competitors received this complaint when we conducted patient surveys. So we've enhanced the font size, we've enhanced the icon size, so CommuniCare Plus is bigger, easier, and just simpler to use. The next pain point was the fact that most diabetic patients, if they input their blood sugar, they fall within a pretty reasonable range. They don't want to input a 3-digit number every single day, 7 days a week. Instead, they just want people to know they're doing fine. So we've incorporated what we call the single tap activity update so that they're no longer burdened by just documenting what they already do every single day. And finally, with many medication management apps, we found that many of the details that patients have to sift through winds up being below the line, so to speak, on their iPhone or their Android. So there's a lot of scrolling involved. At CommuniCare Plus, those details are important to us, and those details wind up mattering when the patient's in the hospital. We don't want scrolling, we don't want to miss details, so there's no more scrolling. We've included 2 kind of cool features as well. So the chart on the left side for you all is essentially a daily, weekly, and monthly tracker for positive health behaviors that a patient takes that the non-clinical caregiver can observe and essentially use to hold accountable their loved ones and family and friends afflicted with their respective chronic disease. We've also incorporated a chat function, which we're going to continue to test, but essentially from our side, we can capture sentiment analysis to essentially determine the level of engagement that a patient's family may have with that patient. In the future, I'm a realist. I know that we have to create something, I apologize. What we're building right now is a 10-point scale for health systems to essentially identify which patients are most at risk for low social circle engagement. For patients who have low social circle scores, we can essentially come in with data-driven intervention methods that are proven to be effective by leveraging the social network. And we continue to research better ways to continue enhancing that feature, but for now, what we're able to do is identify on a 1 to 10 scale which patients need the most help. This is also effective on the other side of the scale. When a patient has a highly engaged social circle, the hospital doesn't need to deploy more resources toward that patient. In fact, that's wasteful, and we're trying to reduce that in our system. In the future, I know that we can't compete on building a better app. There are Googles and Apples that are going to steal all the best developers from us. But what we can do is be the best synthesizer of information from proliferating wearables that continue to enter the market, from other diabetes and other chronic disease management apps that continue to grow, and also from the EMRs that continue to be implemented across the country. We can synthesize and analyze that data in a way that's able to be easily packaged to the social circle so that interventions on the social side can happen, and also to continue building upon the 1 to 10 scale that we built out for healthcare systems to manage their own patient bases. Before we get there, though, we have some quick next steps that we really need to get through. So, this summer, we'd like to do some product upgrades. By September, I'd like to be applying for IRB approval for some true clinical trials to determine whether our product actually impacts diabetic care in the future. From there, we'll raise some money, enroll some patients, and be off and running with actual clinical trials. One more thing. If you're interested, my business advisory team is finalizing a real business plan with financials and marketing structures and operations plans. If that's something that interests you, feel free to catch me after, and I'll include you on our distribution. Otherwise, we're CommuniCare Plus, and we're going to socialize medicine. Thanks.
Okay, our next team from the University of Michigan is AIDA, and they are working on creating a digital therapeutic that provides affordable, accessible, and engaging evidence-based therapy for autism spectrum disorder.
this works. Does it work now? Great. We are Team IDA. Oops. And I want to tell you Brent's story. Brent was diagnosed with autism, and actually coming to this diagnosis was really challenging because autism is seen as a spectrum of disorders, and the manifestation of symptoms can actually look different in each individual. But common to all diagnoses is challenges with social communication and interaction. After Brent received this diagnosis, his family looked at their treatment options. And like the majority of children diagnosed with autism, it was recommended that he receive applied behavioral analysis, commonly referred to as ABA therapy. And this is really the gold standard of treatment. It teaches behaviors using a reward-based system. And it has the most research to support positive outcomes throughout the child's life, especially with early intervention. But unfortunately, at a cost of $120 an hour and an average recommended intensity of 25 to 40 hours a week, families feel overwhelmed both emotionally and financially by this burden. And I know this because Brent is my nephew. And I know that families struggle to decide to limit, delay, or forego treatment entirely. And Brent's family is not alone, because in 2018, 1 in 59 children were diagnosed with autism spectrum disorder. And at IDA, we spoke with some of these families, and we tried to figure out what solution can we develop for them. What we came up with is an affordable and engaging platform that provides evidence-based therapy for children living with autism spectrum disorder. And we do this by delivering therapeutic exercises using software. And this really categorizes us as a digital therapeutic. Our delivery model actually starts with a clinician using standardized assessments to identify what specific behaviors a child needs to learn. From there, the clinician can go onto IDA and search for this specific skill. What they'll find is a curated list of therapeutic exercises that we have gamified that will actually teach the child these behaviors. Something additional that we've done is we've actually matched each one of these challenges to a classification system called ABLE that can be used for both reimbursement purposes as well as measuring and tracking outcomes. So once these challenges have actually been assigned to the child and are relevant to them, they can actually begin to engage in these challenges. Now, we've worked with autism specialists at the University of Michigan to storyboard out challenges for the most common skills that children with autism spectrum disorder need to learn. And we paid specific attention to what game mechanics have already been demonstrated to actually modify behavior in children living with autism. Now, when we did our customer discovery and we talked with families, we heard over and over again that caretakers were not sure how to be the most effective members of their care team. With IDA, we've developed a platform that has a dashboard that will let parents and caretakers know what's the priority that the child is working on, what's the progress that they're making in the game. It'll curate discussion questions that will actually reinforce the knowledge that they're learning, and it'll also have a unique feature called In Real Life Challenges. Now, this will ensure that the knowledge that's being learned in the virtual environment actually transfers over into reality, and the parent will be able to report back on the progress that the child is making, allowing us to measure and track outcomes. With IDA, our platform allows for affordable, accessible, and engaging access to evidence-based care for children living with autism spectrum disorder.
So the IDA platform allows stakeholders to share otherwise decentralized information and collaborate on patient care. But why a game? Research labs out of UCSF and Yale have demonstrated the efficacy of gamified therapy on behaviors, and that validates that we are in the right space. But these labs are not our direct competition because they're not commercializing products to treat social behaviors. Other competitors are either focused on education or are not tied to outcomes and are therefore not evidence-based therapy. As Chanel mentioned, behavioral and social challenges is the only common thread across all autism diagnoses, and we believe that there's a place for us in this market. So, how big is that market? How sizable is this opportunity? Based on prevalence and cost of care, we've calculated the total addressable market to be nearly $50 billion per year. And given the wide severity of autism, we've decided to focus on a subsegment of the population that has the capacity to engage with our product, bringing our serviceable addressable market to nearly $14 billion per year. Now, even at a conservative estimate of a 5% market capture, our market is still $700 million per year. But we expect this number to be higher because our product improves access to those who otherwise don't have access or can't afford traditional ABA therapy. We plan on selling directly to ABA therapists, marketing that they'll be able to see more patients and track outcomes. From there, we can expand and develop games for other age groups. And as we gain clinical evidence, we can then market to insurance companies and medical groups who are interested in decreasing the cost of care for those patients and tracking outcomes. So we have a team with diverse backgrounds, everywhere from education, psychology, engineering, and even business. And we're all unified by our passion to bring evidence-based therapy to patients and make a difference in these patients' lives.
So looking at the next phases of our actual product development, we really need to initially go and expand the expertise of our team. And that's going to start by adding on a game developer that can ensure that we have an engaging platform for these storyboards that we've created. Additionally, we're going to want to gain some additional expertise in ABA therapy. From there, we acknowledge that we have significant risks around data security and storage, and we want to make sure that our product is HIPAA compliant. But finally, we want to formalize some of the initial relationships that we've already established to ensure that we have a consistent testing population that we can use as we test out our pilot. At IDA, we truly believe that we can provide affordable, accessible, and engaging therapy so that Brent and the millions of families like his will be able to receive the care that they deserve. Thank you.
This working? Okay. We're going to move on to our next team from St. Louis. They're called Engine 2 Photonics, and they're working on indoor vegetable farming through advanced horticultural LED technology. Both of these should work. If that's too soft, just wave it. Yeah. All right. You two can use that. I'll use this.
Well, good evening, everybody. Can everybody hear me okay? All right, my name is Rafael Sayer. I'm joined here with Ben and Susanna, and we're Engine 2 Photonics. And it was great that Sumita talked. So she talked about, following your passion. I want to talk to you about our passion. Our passion is substandard mediocre lettuce. That's what we're really interested in. Now the problem, please get down to my level here and consider the lettuce. You order a salad at a restaurant for about $10 and you get something that looks like this. It's on life support from the likes of fried chicken, bacon bits, Hidden Valley Ranch. That's the only thing that's going well for this salad right here. And you pay $10 for that. Does that make you feel good? I don't think so. So the problem is a restaurant would love to serve you much better leafy greens, but all these leafy greens, about 99% or more, come from the sunny deserts of Arizona and California. And they got to make a 2,000-mile trip to St. Louis to be served onto your plate. Now, the ones that survive that trip are the ones that get served, but those aren't always the best heads of lettuce.
So what if restaurants could serve you heirloom varieties that were grown right on their premises and just harvested and walked over into the kitchen? They could serve you varieties like Boston Bib, red oak leaf, red lettuces. They could serve you basil that was just picked directly off the plant and put right on your pizza. Well, with indoor lights and with indoor LED lights and with hydroponic systems, they can do this. And they can grow lettuce that is safer, cleaner, fresher, and it only uses a 20th of the water. It can grow in half the time, and it uses no herbicides.
All right, so let's say you're a restaurateur and you decide, hey, we're going to set up a system like this, and we're going to provide our customers with the best leafy greens we can. And all of a sudden, your lettuce looks like this. Well, that's unfortunate. What's happening there is the lettuce is growing so fast under these great LED lights that it can't transport nutrients to the growing tips of the leaves, and they die. And you get this thing called tip burn. And unfortunately, it ruins your crop. So what we've set out to do is to fix this problem through an intelligent lighting device that not only combines technology that will predict tip burn and prevent it before it can even happen, but it's also going to improve the quality of the produce by improving nutrition, look, and texture and taste.
We've had one of our lights in a restaurant in St. Louis for the past 5 months. So if you've eaten at any of the Lafayette Square restaurants like 1111 Mississippi or Vin Set, you probably had a salad that was grown under our lights. You can see them right there growing Rex lettuce variety. We've also been testing it at our headquarters in a climate-controlled chamber so that we can combine these two experiences and make adjustments to our design.
But one thing that we've learned in working with restaurateurs in St. Louis is that not only do these kinds of customers want a really good lighting technology, but they also want help making sure that they always have the best harvest every single time. A lot of times people don't have the experience to actually use these systems. So that's why we provide a turnkey service, making sure that we can provide the best lighting, hydroponics, and expertise to ensure the harvest every single time. And so besides actually providing these kinds of solutions to other businesses, along with the customer problem solving, we're also developing a quick revenue driver, our MicroGrow USB Grow Light.
The MicroGrow USB light is for people like you. So you can just buy this on Amazon, hopefully by August, and then you can put it in your kitchen and put a seedling of lettuce or a seedling of basil or cilantro, and then you can grow it right in your kitchen, harvest it right when you need it, and have the freshest lettuce available. We have compared this to USB grow lights that are already available on Amazon, and the MicroGrow will make 10 times as much plant material in the same amount of time. And we've been testing this light a lot in our kitchen, so Ben and I have been stuck eating lots of salads.
So let's take a look at the market. Where does indoor farming lie, and what do we calculate the market to be? So we followed the LEDs here, and in horticulture LEDs, this market is projected to be about $8.6 billion by 2022, according to market reports. And the segment of that interests us, which is the leafy greens, the microgreens, and the herbs, that's about 74% of that. And to take a realistic estimate, we're going to capture about 1% of that, and so that's about $64 million. How do we intend to capture that $64 million? Well, we have a lot of competition. A lot of LED manufacturers are making products designated for indoor horticulture, but where we stand apart is that, one, we're not building pot plants, and two, we're developing these turnkey solutions, so we pride ourselves on our customer engagement as well as this tipper and prevention technology that we're filing a provisional patent on.
At Engine 2 Photonics, our team is one of our biggest strengths. Raphael's been studying photosynthesis for 10 years, and he got his PhD in that. I've been working on how light color affects the way that photosynthetic organisms grow and develop, and I'll be getting my PhD in May. And Susanna has been working on genetics for the last 5 years, and will be getting her PhD in June. In addition, we'd like to thank our great team of mentors who has been instrumental in our success to this point, including Stan Hogerby, who operates a $10 million lighting manufacturing facility here in St. Louis, and Jeff Melly, who has been our business advisor throughout the whole process. And just remember, an investment in Engine 2 Photonics isn't just an investment in a grow light, it's an investment in having a great salad every single time. Thank you.
Thank you.
So just before we move on to the next one, we have a quick commercial break. We forgot to put our sponsor banners up, but we have some incredible organizations that have sponsored us and allowed this event to go on and the whole organization to go on, so we just wanted to put these up. So now, Balji, can you slide that more left? Good. Okay, so we're going to move on to our next finalist. This team called Ergo from St. Louis that is working on increasing access to outdoor spaces for people with mobility impairments with an ergonomic device. Right here, that's the clicker. These both work.
Okay, thank you. All right, imagine you just got back from a nice walk in the park. You might be feeling really good. You have a good mood, you feel more energized, ready to do the rest of your day, and you might get some better sleep that night. Some people, however, are not able to reap the short and long-term benefits of that nice walk you took because they might be afraid of falling. We are Ergo, and we are here to help people of all abilities get outdoors. My name is Leah, and me and Luna have expertise in helping people get back to the things they enjoy. Spencer and Joe are our product developers, and Ahmed is our market researcher. Today, we'll walk you through the problem with current mobility devices on the market, our solutions to these devices, and how we plan to market and commercialize our product, as well as our future plans. Now Luna will discuss the background to the problem.
4.8 million Americans currently use canes as a mobility device to access outdoor spaces. However, canes are the imperfect solution. So currently, quad canes offer more balance support than a regular cane. However, they're frequently misused and they're pretty heavy. So hiking sticks are on the other end. So hiking sticks support a natural gait. However, they also don't have a lot of balance support. So both hiking sticks and canes are not appropriate for slippery surfaces or rough terrain. So the option available in the market are these attachable bases. They are not easily swapped between the cane and whenever you go outside. And they also are not used for both indoor and outdoor spaces very easily. So now that I have presented the problem, Spencer will be speaking about the solution that we have found.
Our product is an attachment for any existing cane or hiking stick to give it the best advantages of quad canes, hiking sticks, and those attachments for canes that are pretty clunky on their own. So we have a wide base of support in our device, which simulates how a quad cane tries to stretch out and take up more of the ground and give you more support, but the fact that it's one piece means that it will always contact the ground the way you want it to every time. There's also a flexible ball joint on it, which gives you the same sort of natural range of motion in your gait that a hiking stick does. And then also we wanted to incorporate the ability to be both indoors and outdoors. But you have very different needs when you're indoors and outdoors. If you're indoors, you want something like a rubber padding like you see in normal cane tips. But if you're outdoors, you might want something more like cleats that can help grip the ground. So we made our ball joint a magnet. So you can just step on your base, lift up the cane, and then it completely detaches. And then you set your cane straight down on whatever base you want to use next, and it attaches. Magnets are strong enough to lift the base, so every time you don't need to worry about the cane following you when you're walking. So you just switch over to your spiked base and you're ready to go on a hike. So we have 3 distinct advantages with our base. So number 1, there are completely no tools that you need at all. All I had to do was step on it and it just lifted up very easily on its own. Secondly, our outdoor base, because it doesn't have to be an indoor base too, is able to deal with pretty much any environment that may be demanding that you deal with, like a rough trail or slippery ice. We also can adapt our device to any cane or hiking stick, so people who want to use it can use it on any device, whatever they're familiar with, whatever they're most comfortable with. The fact that it's compatible with so many devices means that we have a really wide market that we can capture part of, which Joe's going to elaborate on.
About 1 in 4 older adults have an ambulatory... About 1 in 4 older adults have an ambulatory disability that may benefit from using a mobility device. However, a lot of people are uncomfortable with the negative stigma that is sometimes associated with medical devices. For people with minor mobility impairments, such as older adults or some people with Parkinson's disease or MS, our device provides the support and confidence they need to get outside, be active, and stay independent. Now, some other companies have provided solutions to some of these problems, such as Hurricane and Hugo, which are depicted here. While their products do some improvements over traditional canes, they don't solve all of the problems. Neither of these products provide a way to easily transition between indoor and outdoor use or provide support throughout your entire natural gait. Our pivoting magnetic base does both of those. It gives you an easy way to walk inside or outside, and it also supports you throughout your entire stride. To talk to you some more about how we're going to market these advantages, Ahmed's going to walk through our commercialization approach.
To commercialize our product, we plan on licensing our patented technology to manufacturers using existing supply chains. We also plan on partnering with community organizations like the American Parkinson's Association in We also plan on raising awareness of our product and how it may benefit people with mobility impairment by partnering with this American Parkinson's Disease Association. We also plan on educational outreach promoting physical activity by partnering with community outreach organizations. And so approximately $85 million is spent annually on canes in the United States, and that number is expected to rise to over $100 million by 2024. And about $71 million is spent annually on hiking sticks around the world. We can capture a portion of this market to help our company grow. To talk to you more about the future of our project and the future of our company, here's Leah.
We have filed a provisional patent and plan to file a utility patent by the end of 2019. By 2020, we aim to license, advertise, and distribute our product, as well as continue to work on our mission of promoting outdoor access for people of all abilities by developing further products. To summarize, our product is an easy-to-use attachment that can go on any hiking stick or cane and promotes user stability as well as usability. Let's get everyone outdoors.
All right, halfway there. Our next team from St. Louis is Hive, who is working on improving noncompliance in IV medication in outpatient parenteral antibiotic therapy patients.
Hi, everybody. My name is Joe Beggs, and I'm the project leader for Hive. I'm first going to introduce you to a clinician that we're working very closely with, Dr. Yasir Hamad.
Hi, everyone. Thank you for having me. My name is Yasir Hamad. I'm an infectious disease physician here at Washington University. And I also direct the OPAT program. OPAT, as you see, it stands for Outpatient Parenteral Antimicrobial Therapy. It simply means treating patients with IV antibiotics in their homes. Over 300,000 OPAT courses are prescribed each year in the United States, the same as the size of the breast cancer. So the way this is given is the patient usually gets a special form of an IV line called a PICC line, which is shown here as a yellow line. It goes just like a regular IV, but it goes deeper into the bigger veins closer to the heart. This allows the patients to get their antibiotics at home. On the other side of the picture here, you see a medication pump. This is a pressurized bag that has the antibiotics inside, and the patient will need to connect the end of the tubing into their PICC lines for the antibiotics to flow. To give you an example, Jack is a patient who had osteoarthritis. He had admitted to the hospital to get a knee replacement, which was unfortunately got complicated by an infection. Now Jack will need to finish 6 weeks of IV antibiotics to treat that infection. He gets discharged to his home, and Jack now has to administer antibiotics through the PICC line for an hour twice daily. It gets complicated for Jack and many patients to process this task, which leads to many patients not taking their antibiotics as prescribed, which can lead them to get back to the hospital, which is a problem we want to fix. From our data from 2017, we found that about a quarter of patients who were discharged on OPAT each year got readmitted to the hospital. And 16%, as shown in the golden color, are OPAT-related reasons. These are merely either worsening of the infection or complication from the adverse side effects of the medication, which is the antibiotics. This is an extremely expensive problem. While OPAT can cost around $250 a day, being in the hospital costs over $2,000 each day. And we know for sure from anecdotal reports and data and reports that noncompliance is a significant contributor for these readmissions. So that's why I actually approached Joe on the problems there for Sling to help us address this problem. So I asked Joe to show us what solution he developed for this problem.
Thanks. Yeah. Thank you very much. All right, so I'm going to walk you through pretty quickly. This is a video of our patent pending technology. So as you can see, this is a recreation of a patient here. So you can see the IV line coming out of the arm. Our sensor is on the end of the PICC line, and all we're doing is detecting when the medication is connected. So this data, it's hard to see in the video, but it's on our piece of software here, we're showing that the medication is being administered, and when it's completed, we show how long the medication was administered for. Now, you might wonder, where is this data going? Because we're working in close partnership with Dr. Hamad and Home Health Services, the data goes straight to Home Health Services so that nurses can intervene and stop the unplanned readmissions before they even happen. So we do have some competitors. We have direct and indirect competitors. Epic is our direct competitor. And some of you may be familiar with the non-compliance field, but a lot of people are coming up with apps, and Epic is no different. They want patients to log when they take their medication. Unfortunately, if you know a thing or two about non-compliant patients, they already struggle to follow the steps that they're prescribed. So why does it make sense to add more steps to solve non-compliance? Our other competitors are crafting expensive, bulky sensors for hospital IV administration, or they're not even looking at OPAT in the first place. So we have a $4.2 billion market. This is based on 1998 numbers. There's 317,000 patients on OPAT nationally. OPAT is extremely cost-effective, $250 a day versus $2,000 a day, spread over the course of 6 to 8 weeks. So our game plan going forward, and I believe this is one of our strongest points as a business. So because we're working in such close coordination with Dr. Hamad and Home Health Services, we already have plans to launch a small-scale clinical trial once we perfect our prototype over the summer. So my team is going to stay here in St. Louis, and this is what we're doing. Once we show efficacy and safety, we will, in Home Health Services, selling the devices at $40 a pop. That alone, that $320,000, is enough to pay for our device outright without reducing any readmissions in the first place, because our device only costs $30 to produce. Once we show the efficacy and safety, we believe that insurance and the hospitals will help pay, or will pay for our device. And we can begin charging about $250 per device. So assuming, and now this is a projection, obviously this will change, but assuming a 50% market penetration, that's 150,000 patients times $250 a device, that's $38 million in revenue per year. So I'm going to tell you a little bit about my team. So last summer, I was inspired by Michael Loeb, the founder of Priceline.com, who was my mentor to get involved in entrepreneurship and really go all in. Unfortunately, he didn't know too much about healthcare, so that's where I thought I could contribute because I know about healthcare. So I'm bringing the two together in this project. Along with me, there's Chris and Glenn. They're my engineers. They are working on prototyping this summer. Sai and Ali are clinical coordinators. They're also working in Dr. Hamad's clinic and interviewing patients every single week so that we can really understand this problem. In our immediate future, we have 8,000 patients that BJC Home Health Services oversees, and this is our immediate market. Thank you very much, and please, I'm happy to take any questions later.
Our next team from Atlanta is Inno Health, and they are empowering communities to eliminate infectious diseases. Yeah, maybe. Oh, there you are.
Excuse me? Hello? Okay, cool. Hi, I'm Angela Odongo with Inno Health Diagnostics, and we are in the business of empowering communities to eliminate infectious diseases. So I'm going to take you through the problem, its impact, and our solution. And then I'm going to tell you why we're the team to do it, our next steps, and the partners who are helping us to get there. And I'll tell you why we're different than the current methods, and then just how big the market really is. So this is me at 5 years old, right? Cute. And this is my co-founder in KG at 5. And this is 5-year-old Bello. We're all from Nigeria, where in many regions, 1 in every 3 kids are infected with schistosomiasis. And unfortunately, in this case, it's Bello. Schistosomiasis, or schisto for short, is a parasitic disease that damages internal organs and causes malnutrition. Worldwide, over 1 billion people are either affected or at risk of schistosomiasis. And in Nigeria, our focus market, over 130 million people are either affected or at risk. And this disease kills over 200,000 people yearly. So let me reintroduce you to Bello. When Bello is playing in contaminated water, he's exposed to schisto, where the worms have a chance to penetrate his skin pores and invade his entire body. And once infected, Bello will become feverish, experience rashes, and develop unusual tiredness. But if not detected early, this can progress to stomach ulcers, bladder cancer, and even Bello's death. We at Inno Health have a solution. Once Bello's mom notices his progressing symptoms, she'll try her home remedies, but once she sees that they don't work, she'll go into a local clinic and get the Inno Health chip. Now this chip will be able to accurately detect the disease early when treatment can be provided at a lower dose, meaning giving children like Bello an excellent chance of being cured. And so how does this work? Well, once the urine is transferred into the chip, then the worm's eggs are isolated and lysed, and then the DNA is extracted and amplified. And so target small sequences called primers bind to a small portion of the worm's DNA, and the chip's able to produce copies of that DNA and combined with a dye, produce a visual result of a positive detection that's readable to the naked eye. And so this is why we're the team to do it. Our backgrounds vary from public health to biotechnology to biomedical engineering, global infectious diseases, and many more. And we are so excited to see the impact that Inno Health can make. And so this summer, we partnered with eHealth Africa to produce field tests where we'll distribute 250 units of the prototype and then go through a customer validation phase where we'll gather data and analyze it and iterate on the current model. And we'll do this cycle 2 more times in the next year, and with the goal of producing a government-certified minimal viable product. And we believe we can get the minimal viable product with these costs, that sum up to $79,000. And so this is a public health mission, and we need partners on the ground. We currently partner with eHealth Africa, which is a biotech not-for-profit in Nigeria that's providing us resources for R&D this summer. And we partnered with Jaltech and Sling Health Atlanta to work on our prototype and our business model. And in the next years, we plan to target the Gates Foundation, which has dedicated $2.2 billion in the next 5 years to eliminate neglected tropical diseases like schistosomiasis. FindDX, which is a partnering product development company that pairs up with companies like Inno Health that produces innovative technologies for poverty-related diseases. And then we've already started conversations with the Carter Center's team in Nigeria that's implementing mass drug administration programs throughout Nigeria. And so the current methods check these boxes, but we need more boxes checked for disease elimination. Take the standard method of care, which is identifying eggs on a microscope. This takes lab personnel and is time consuming, and the lab equipment costs a lot of money. But we at Inno Health are developing our products using DNA amplification technology with the goal of eliminating schistosomiasis by bringing home devices and point-of-care devices in a culturally competent manner for early detection of the disease. So we have a serviceable addressable market in Nigeria of 131 million people. But in our pilot market, Kano State, there is 4.7 million people either infected or at risk. So in the first 3 years, we plan to target 0.1% of that market, where we've identified almost 470,000 people affected or at risk. And so we've calculated a revenue stream in those years, year 2 and 3, of $934,000 by just targeting mass drug administration programs, which is just one method of our distribution channel. So to summarize, we've identified a massive problem, showed you the anal health solution, showed you why we're the team to do it, and showed you what makes us different in the market and how big that market is. Our team's been working for the past year and a half on this business and technology. We're so excited to see what early detection can do and how it can improve the lives of millions of people. So please join us in empowering communities to eliminate infectious diseases. Thank you.
Okay, our next team from the University of Michigan is Oryx, who is working on empowering dental clinicians to do more with less and make it easier to provide quality care to patients.
You're my patient, and I'm your dentist. And as your provider, I want to give you the best quality care. But sometimes I can't. This is why. I need to be able to see what I'm doing, but the view on the mirror gets dirty and obstructed, and I'm forced to make compromises just to get the job done. To see if other people also cared about this problem, we've interviewed with dentists. And we validated that this is a problem, in fact, worth solving. Just by asking what they liked or didn't like about dental mirrors right now, we found that 100% of them self-identify this visual impairment as a real problem. We also learned that the severity of the problem varied drastically, and it was far worse for pediatric dentists with uncooperative children who's having a hard time in dental chairs, and also restorative dentists who require a high level of precision in their work. And you know what else? Restorative dentists make up 80% of the dentist population. And right now, they're all just stopping mid-procedure to clean their mirror numerous times. And so that is highly disruptive to their current workflow. So at Oryx, we're developing a solution to get rid of this age-old problem once and for all. Oryx Clarity is a portable, self-cleaning dental mirror device that generates airflow from the body onto the reflective surface, keeping it clean and dry, with a consistently clear indirect vision for the provider. Now that brings three main values to providers. First, with an uninterrupted visualization, they can achieve the same or better quality work faster. And as a user-friendly device that is able to eliminate interruptions, the Oryx Clarity can also improve the workflow. And lastly, the providers won't have to twist and turn to be able to see better. Over 85% of dentists have developed musculoskeletal disorders after they started their profession. So by using Clarity, they can maintain their healthy posture and prevent the back pain and protect their long-term professional longevity. And what that means for you as patients is that your dentists don't have to be so close to your face. So our product has many benefits. But with that said, what does the market look like? Well, we've seen a 6.4% of annual growth rate for the last few years. And as of last year, the dental equipment and supplies market was valued at $16 billion, $1.4 billion of which is the segment that the Oryx Clarity belongs in. But what does that mean in terms of what we, Oryx, can capture? Well, we segmented the customers in the US to be able to better estimate that. In the user segment, we have over 400,000 providers, and that will be our initial market entry segment. The other decision makers are practice managers and academic institutions with over 30,000 students in any given year. Then we have distributors and payer systems with a variety of sales channels. So how do we plan to generate this revenue? Well, this revenue of early projection of $344 million is the result of this analysis. So how do we go about capturing this revenue? Our product has two parts. The one-time purchase of the internal unit, which has a motor housing unit and a battery system that is rechargeable. And then we also have the consumable shell that's made with the heat-susceptible material. That part will have a limited lifetime, and so through the use of repeated sterilization in the autoclave, it won't fit onto the motor housing unit anymore, so that part will be sold on a recurring basis to drive profit.
The good news for us is that there's already predicates on the market. On the metrics of effectiveness and ease of use, we believe that Clarity will do the job to be done better than our competition. So the competitors right now are Everclear, which uses a spinning mirror system, but introduces mechanical risks and has sanitation issues. Newbird and PureVac use suction, but are hooked to the air system of the dental chair. This tubing is very cumbersome and requires additional maintenance. Yairo uses airflow, but is also hooked to the tubing of the dental chair. And what we believe is our greatest competitor right now is the status quo dental mirror, because that's what clinicians are currently using. But Clarity is differentiated with a competitive advantage of being the first portable and cord-free mirror that actually solves the problem without introducing any additional hazards or risk factors. So when we were developing Clarity, we talked to clinicians to see what they really wanted. And these were the key factors they identified. So we made sure to incorporate these in the prototyping process. We're currently on our 5th iteration of the prototype, and it fits very well in the hand and is easy to maneuver. It assembles quickly and easily, and all of the moving components fit within the outer shell away from patient contact areas. As we've been optimizing this technology, we've looked into getting a provisional patent, and once we fully optimize the functional prototype, we will be fully patenting and looking for FDA approval. So here are the next steps for us. On this timeline, you'll see that there's 2 different exit pathways. Once we get FDA approval and complete a clinical pilot, we will look to form a company with a go-to market strategy or look for a licensing agreement and exit that way. As a team, we are well positioned to execute these milestones. Jay is U of M's first dual degree Doctor of Dental Surgery and MBA student and is our team lead and founder. I'm Paul, and as a biomedical engineer, I'm leading the prototyping and product design process. Betty is a mechanical engineer who is championing the analytics. Irrespective of our skills and diversity, we are addressing our growth areas with our expert network. And beyond this, we also have a working relationship with some of the key entrepreneurship resources on our campus in Ann Arbor.
Thanks, Paul. So now, I want to bring you back to where we started, the pain point. As a company, our mission is to empower clinicians by making their job easier to provide the quality care that they deserve. Oryx Clarity can deliver that difference by helping dental providers to see better and achieve greater efficiency. And for you as patients, would also gain the benefit through higher quality treatment and shorter appointment times. You see, significant innovation can happen through small changes. And Oryx Clarity can be that small but impactful change. Thank you for your time.
And now we will have our final finalist of the night. It's a team called Quill from the University of Pennsylvania that is working on a voice-based EMR assistant helping providers seamlessly transcribe notes, find medical records, and bill accurately.
Hi everyone, my name's Tyler Martin and I'm the CEO of Quill AI. I'm an integrated product design master's student at the University of Pennsylvania. I'm honored to be joined by my incredibly brilliant co-founders, Hoyt Kong and Lauren Mead. Hoyt is a life sciences and management undergrad student at Wharton, and Lauren is a third-year med student. Over the past few months, we've spent countless hours interviewing doctors, patients, and administrators at hospital systems trying to figure out what works and what doesn't work with EMR systems. And big surprise, doctors really don't like interacting with EMR systems. It's our mission to fix that problem. This all started about 9 months ago, and I was chatting with my best friend, Will, who's a cardiologist. Will was so frustrated at the amount of time he spent looking for lab results in the EMR system while his patient sat next to him waiting for a reply. Will's trying to connect with his patient, but he's stuck interacting with this EMR system.
And so typical encounter begins for Will by coming into the room. He completes a physical and a history. He then comes up with a therapeutic and diagnostic plan and leaves the room. Afterwards, somebody like Will working in an outpatient setting may see as many as 30 or 60 additional patients. And before Will goes home that day, he needs to complete and review notes for all of those patients.
And in that process, Will has several points of friction. For one, he's unable to look into the EMR and find data like lab values while still talking to that patient. Second, EMRs were made for billing purposes. Doctors aren't trained nor incentivized to bill to the maximum extent, leaving value on the table. Lastly, doctors spend upwards of 2 to 3 hours per shift just charting notes, leading to high burnout rates and inaccurate documentation.
So how do we solve this problem, and how does Quill work? At a high level, Quill is an interface between a physician and an EMR system. That breaks down into a couple of pieces. Number one, it's a smartphone app that is passively listening to a patient conversation, sending information back to an EMR, to our Quill system. While we're doing that, we're looking for key contextual clues in those sentences that the provider is saying to the physician. To do that, we are able to bring forward some very real-time important data so that the physician can make decisions. So for example, if Lauren's my physician and he's asking me about my hypertension medications, Quill will be asking the EMR system, hey, can I get all of those blood pressure readings? Quill will visualize that entire history. It will plot on the chart when various medications were given so that the physician can really provide decisions without spending time looking through the EMR. And finally, because we have all this textual information of the conversation, Quill writes a physician's note for the physician. Using a combination of machine learning techniques and human scribes to increase accuracy, we will prepare notes in a way that are accurate and timely for the physician.
We have two main sources of revenue for Quill, one speaking to the power of transcription and clinical documentation improvement, and one to our data play. In order to cover overhead costs, we serve our remote medical transcription with an annual base fee dependent on the size and scale of our EMR clients. We charge $10K a year per physician, comparable with existing competitors, and even cheaper than some of the current technologies. On the back end, our data that we collect from our transcription services poses value as well. We're able to store this in an anonymized, queryable database, in which then we can license out to, say, contractors, like scientists or clinicians, to do these quality improvement and clinical research studies. And the time is ripe right now. The global medical transcription market sits over $53 billion in 2017 and is projected to grow even more. This, along with the tripling rate of the clinical data analytics market, makes this a perfect opportunity. We plan on starting in the US outpatient services, which has been spending high growth in the information technology spending. And on our competitors, we've done our research and segmented them into three main components. On the left is the competitors with no AI technology, using mainly speech-to-text dictation practices. In the middle, we have the AI solutions, which fall short in their inaccurate abilities to, say, rely on only an algorithm, and fall short in their capabilities to actually process data. The only real direct competitor we have is Augmetics, which also uses a human plus AI hybrid. However, we believe that our real-time search robust model serves to play down the road with that data. And really speaking to our competitive advantage, that goes back to our human-in-the-loop model. Using the supervised learning technique, we're combining the best of both worlds with human medical transcription and intelligent automated transcription. This process of human-in-the-loop allows us to learn from existing past notes and train to even higher accuracies like never before. This, coupled with our real-time search, poses as our competitive advantages.
And so to make this vision a reality, Tyler's brought together a uniquely suited team with a combination of technical, business, and clinical experience. Tyler himself is already an accomplished entrepreneur with several consulting businesses to his name, for which he's leveraged past work experiences as a consultant at Deloitte and also building search technologies for U.S. intelligence agencies. My friend Hoyt here is an accomplished clinical researcher and has an understanding of business development that he's garnered from the #1 undergraduate business school in the country. And I add a clinical perspective along with some lessons I've learned in launching a clinical decision support tool and in piloting a mobile health app for Penn Medicine employees. In order to fill gaps in our knowledge and also to open doors in the healthcare industry, we've gathered some mentors across our campus in notable institutions such as the Center for Healthcare Innovation, Wharton's Entrepreneurship Community, VIPC, and finally the Integrated Program for Design. And so as part of our next steps, we're going to be launching a small pilot in an outpatient setting where we'll be testing and validating our HIPAA compliance service before we expand direct sales and capture market share. And we've already made great strides. First, we've done extensive interviewing of physician end users. We've also built an MVP, and we've secured support in the form of grants and in-kind awards. And so next for us, we'll be building out our product a little bit more and testing it in Penn Simulation Center, where we're going to use clinicians, medical scribes, and paid actors to portray real-life clinical scenarios. And this is all part of a strategy to systematically de-risk our proposition with that first validation in the Sim Center, as I mentioned. Then we'll be launching our HIPAA-compliant clinical pilot. And as we grow and refine our tech, we'll continue to increase our defensibility by filing patents and eventually integrating with EMRs.
Building a production version of Quill is going to take a lot of hard work and some capital. We appreciate the opportunity to share our vision with you, and we thank you for your time.
So that concludes the pitches for the evening. Let's just give another big round of applause to all of our finalists for some phenomenal pitches tonight. So the next thing we wanted to do while we start tallying up the judges' votes is one of our biggest supporters and sponsors over the last couple years has been the American Medical Association, who has funded us as a group, has helped us reach out to new chapters and grow, and now has worked on us on a very, very cool new project, which is a clinical problem database. So we are thrilled to have Stacy Lloyd here from the AMA, who's going to tell you a little bit about this new thing that has launched as of yesterday. So come on up, Stacy.
All right. Hi, everyone. Good evening. Thanks for having me. Thank you to the Sling Health team for inviting me to talk about our new work together. And congrats to all of the teams that have demoed today. This evening is really about all the work you've done over the last year. And it's been my first time getting to attend Demo Day as a part of the AMA. And it was really inspiring and awesome to see. On behalf of the AMA, we're a proud partner of Sling Health, and I'm really thrilled to be here to talk about the clinical problem database today. The AMA in general is really committed to fostering healthcare innovation from concept to clinical integration, and ensuring that physician voice is included in new solutions and products coming to market. With Sling Health's focus on medical student leadership and innovation in healthcare, it really makes for a very natural, synergistic fit for our organizations to work together. So over the last 6 or probably more so months, we have been working very closely with especially a few folks in the room tonight to really create the clinical problem database. And, from my understanding, really up until this point, the problems that everyone here today has worked on have really been sourced at that local level, at their university, at the health systems that they work closely to, maybe personal experiences or connections, which is really wonderful. But by kind of putting together this digital evergreen version of the clinical problem database, we're really expanding its reach to really source those problems from across the nation to ensure that the solutions that are being built today are around problems that are really needed across a wide net of physicians, real healthcare problems that we're seeing across the entire industry today. So we are launching just yesterday officially, but very quietly, the Clinical Problem Database, and it is hosted on the AMA's Physician Innovation Network. So what is the Physician Innovation Network and why is it a fit to be hosting the Clinical Problem Database? Physician Innovation Network, we call it PIN for short, it's a mouthful, is really Match.com meets LinkedIn for health tech companies and entrepreneurs and physicians, really bringing those two sides of the market together to, again, ensure that physician voice is really represented in the solutions, especially in technology and digital health solutions that are coming to market. I think, from the AMA perspective, we learned a lot from the integration of electronic health records across the industry and how many physicians, like you just heard, don't really like them. So with these new digital health technologies that are coming into the market, we really want to make sure that that physician voice is represented in those early on. So in addition to kind of that matching of physicians and health companies and entrepreneurs, we also want to get rid of the noise in the industry as well. And again, that goes back to really making sure that we're solving to real problems, and the Clinical Problem Database is really a way we can do that. So a little bit about the Clinical Problem Database and how it works. So you'll see on the screen there's a link to the database, and it has its own landing page, and it directs you straight to the problem list. We didn't necessarily want folks to have to navigate it through the Physician Innovation Network if really they were going to submit a problem or look for problems to solve. So that landing page will then take you into the page on the right of your screen, yes. And then you'll see the ability to submit a problem. A couple of things you can do here. One, you can go through this evergreen list of problems to see what's already been suggested. And if that problem is something you're also seeing in practice or also very interested in solving, you can vote for that problem. So it's also a way to crowdsource really feedback on the types of problems that are being submitted and surface those ones to the top that a lot of people are experiencing as a real need or pain point across the industry. If you don't see your problem in the problem database already, then you can go submit a problem, put in some information. If you're interested in being a part of the solution development, you can note that in the submission form. And then also on the side there, we have created kind of a right widget that allows you, if you're interested in getting involved, you can reach out to the Sling Health team and they can help connect you to the team that's working on that. Some other functionality that we made sure was also a part of this was the screenshot below, and it designates whether a problem is actually being worked on. So again, if you want to work on that problem, you can reach out to the Sling Health team to get involved. So other opportunities on the Physician Innovation Network, like I said, this is one piece of the Physician Innovation Network, and you can come and submit a problem, look at the database and leave, or you can have access to anything else that is on the Physician Innovation Network. So for physicians, you can search opportunities with health tech companies. You can have access to educational resources on physician entrepreneurship and digital health and digital medicine, and you can also participate in virtual panel discussions. For entrepreneurs or companies on the other side of things, if you're looking for physician feedback or want to connect with physicians, you have the ability to do that through the broader Physician Innovation Network site, as well as, again, kind of educational content and participation in the virtual panel discussions. We run those about every 6 weeks, and the topics really span the gamut from going from talking about design thinking in healthcare all the way up to, innovating with patients and bridging the app gap, really getting apps from development into clinical integration. And again, that's available to anyone that comes through the clinical problem database. And I think it's really wonderful too that the Sling Health teams that then start to create solutions around the problems also have access to that wider network of physicians that are already on the Physician Innovation Network. And to date, we have over 3,000 physicians, residents, and medical students available to connect with through that network. And I was fortunate enough to be able to listen in on some of the panels earlier today that were focused for the Sling Health members. And, despite being a group largely of medical students, you still need that access to physicians to kind of vet your problem above and beyond that N of 1 or 5. So I think that's a really good opportunity to kind of easily navigate through this one site to get all of that taken care of. So we have at the AMA been partnered with Sling Health for a couple of years now, and we've had a really wonderful opportunity to support the demo days, help with chapter growth, and now I think a little bit more closely working together on this clinical problem database. So we're looking forward to really continuing to expand that collaboration and that relationship and provide strategically access to Sling Health to the resources and initiatives across the AMA. A few that come to top of mind are our Accelerating Medical Education Initiative, which is a consortium of 32 medical schools that have signed on to really redefine what medical education looks like today. That really hasn't been changed in 100 years or so. So they're really thinking through what does medical school look like today and how do we prepare medical students for actual practice today. And that is inclusive of health system science. It's inclusive of technology and digital health solutions that are now, patients are asking for and physicians are using in practice. So I think there's a lot of opportunity to really continue to grow Sling Health chapters in collaboration with our Accelerating Medical Education Initiative. And then additionally, because of the success of that program, the next step is really looking at the residency program. So that is going to be starting and kicking off very soon. And they're really looking at, again, what does residency look like? What does that curriculum look like? What does that experience look like? And really making sure that residents are getting that exposure to other sides of medicine that aren't traditionally, haven't traditionally been included in their residency programs. And I think that's really wonderful as we, as I've continued to hear throughout the course of the day, there are lots of folks that are a part of this organization and are kind of rolling off to go to residency, but how do we help kind of allow them to go through residency and also continue to kind of follow some of these passions and the work that you've started at Sling Health. So those are a couple of areas that I'm really excited to see grow, and I know the Sling Health team is going to come up and tell you a little bit more about their future growth as well. So thank you.
Thank you, Stacy. I just want to echo the sentiment that we are super excited about this clinical problem database, and the Physician Innovation Network is a very, very cool place, and there's something for everyone. So do check it out and check out the problem database. We're now going to have our president, Steve Linderman, and the president of the St. Louis chapter come up to say a few words, and then we'll announce the winners.
Hi, thank you all so much for coming. It's been really surreal over the last 6.5 years seeing this organization grow from a medical student engineering interest group into a group that's pulling together students from across campuses locally, across campuses nationally, onto teams that they're able to showcase here today. We've had several of those teams in previous years able to launch forward into companies. It's really been an amazing experience, so thank you so much for coming out to see it. We really appreciate all of the support from our judges, our sponsors that have supported us for the program over the years in general, as well as for this event in particular. I personally am about to graduate from my MD PhD program here at WashU, stepping out of the presidency role at the national level as I move into internal medicine residency at Emory in Atlanta. So I'm excited to get more engaged with the Atlanta chapter. But I'm very excited for the future directions of the program. Mario is going to talk to us a little bit more about that later. And it would not be possible without all of the amazing work of hundreds, over 1,000 volunteers over the past several years, as well as about 750 students that have participated on teams. Thank you.
Hi, everyone. I'm Kayvon again. I just wanted to echo a lot of Steve's comments and just say here at St. Louis, it has just been such a pleasure to be able to work with the entire entrepreneurial and medical communities here in St. Louis. It is such a special place. Everyone's so close-knit. I was just so blown away when I was able to have coffee with venture capitalists without even having to set up a meeting more than a couple days in advance. And it really helped me grow as a person. And I've just been so amazed by how these teams every single year do so incredible here in St. Louis. At our chapter. I just wanted to also say, thank you all for coming. I know it's been a long night. I hope you've had a great time. On a far less sentimental note, there is an iPad that someone left here that's red. So if you want to come take a look at it and see if you can unlock it, then we will give it to you. But thanks again. I will also be leaving. I'm starting internal medicine residency over in San Francisco and be moving in a month. So our next president, Audit, will do, I'm sure, a fantastic job. So looking forward to seeing you all next year as well. Now we're going to hand it off over to Mario, who will tell us about the results of the judges.
All right. Yeah, thanks everybody. It's great to see you all here today. I just want to give one more thanks to all the teams who were awesome, and the keynote by Dr. Penator was great. So one more round of applause for that. So my name is Mario Russo. I am the Michigan president for Sling Health, and I'm also the VP of Technology for the National Executive Board. And as a student who has been involved from Sling Health, starting day one as a team member, then moving out to Executive Board, I have seen how impactful it can be for every student's lives. And that's really what the mission of Sling Health is. Like, how can we train the next generation of leaders in medical innovation, medical entrepreneurship, and help those students make impact on healthcare and make that impact now? Because we as students are all capable of doing it now, and Sling Health really facilitates those connections that make that possible. And so as Sling Health has grown from a St. Louis chapter in 2013 to the 12 universities it's at now, it's amazing how much more we think we can expand. And why I think it expands so well is how that problem just is persistent all across the country. Students are capable of solving those problems, and we just need those connections in order to bring the students together to make that impact in healthcare. And that's why we believe Sling Health is being super successful in helping students make an impact. And so with that, we've made quite an impact today alone. I'm very excited to announce the winners of the event. So the poster audience favorite for the Sling Health competition today was Ergo. So round of applause to Ergo. Then we have 6 teams that placed as finalists. All 6 teams are going to get $1,000 in pro bono legal support from Hush Blackwell. And so in no particular order, the honorable mentions for 4th through 6th place is Engine 2 Photonics, Oryx, and Ergo. So round of applause for those teams. Then, for what I think is the first time ever, we've had a tie. So for second place, we've had a tie between Quill IA, AI, and IDA. So congratulations to those 2 teams. And then for our grand prize winner, $5,000, winner for Demo Day 2019 is InnoHealth. So congratulations to that team. Yeah.
Thank you. If you have any questions, I'll be around. Please ask. Thank you.
Before we get out of here, I just want to say thanks again to all of our sponsors for the continued support of helping us train those future leaders in healthcare and helping make that change in patient care. So thanks again to everybody. Hope you had a great night and hope to see you all again next year.